Hello and good evening, and thanks for attending our webinar tonight. I'm just going to try and make my screen just a little bit bigger here before I get started. There we go. But yeah, thanks for joining us this evening. Before we get started, I have some housekeeping information. We are recording the webinar this evening, and we will make it available on demand. If you are experiencing difficulties with audio or video, usually the best solution is to log out and then back in again. If that doesn't work, you can call in using the phone number on the screen. Kayla will send out this number in the chat. She'll send it out several times. We will also send out instructions on how to view the on-demand version, so please watch for BCDHA communications. I would like to say thank you to the Workco staff and company for partial sponsorship of this webinar event. We are responding to your feedback and have changed how our webinar will work this evening. We have previously recorded the presentation and we will play this recording for you shortly. The presenters, Nikki and Jade, will take your questions that you enter into the chat or the Q&A, consolidate them, and then they will answer those questions live at the conclusion of the presentation. So please feel free to include your questions as their presentation is going. That will give them an opportunity to read what your questions are and to try and frame a nice answer for you. My name is Wendy Jobs, and I'm the manager of Dental Hygiene Practice, and I'm your moderator for this webinar. Welcome also to Jazz, one of our newest employees. He's taken over the role as one of our practice advisors, so you'll be seeing more of Jazz in the future. I would like to take this opportunity to recognize all of the traditional territories upon which dental hygienists work. Oh, there, I see Jazz turned on his video. Hi, Jazz. Thanks for turning that on and giving us a wave.
Hi, everybody. Looking forward to being more involved with more webinars.
Great. Yes, and we're definitely have him lined up for that. That's for sure. Thanks, Jazz. Please have a quick look at our disclaimer statement. Nothing too shocking or scary there. In order to see the menu bar, I'm sure most people are actually very familiar with Zoom at this point, but for those of you, and just in case you're not very familiar, if you move your mouse around, if you're on a tablet or a smart device, the menu will pop up, and at the bottom of your screen, you should see the chat. We won't be using the raise hand feature of the platform right now, but the Q&A is here and the chat is there, so certainly send in your questions. Just a reminder that you must log into your CDHBC online learning platform and add this activity to your QAP. BCDHA does not offer certificates, so the best suggestion is to keep your registration information, your notes, and any other documentation that might demonstrate your learning. CDHBC has also made it possible to upload electronic documents so you can scan and house this kind of information directly in your online profile so that you don't have to keep paper copies of things. Kayla has listed the handout for tonight in the chat, so please feel free to download that so you can follow along with the presenters. And remember that the suggestions we make for CE are just that. They are really just a suggestion, and it is up to each member to decide how this event might fit best into your professional development. At the conclusion of our webinar, as you close out of Zoom, you should be directed to our post-event survey. Please take a few moments to complete these surveys, as they really help us try to determine what's working, what's not working, and how we can bring you good and quality events. Just a reminder, as that we are recording, and our webinars are normally available on demand on our website. So if you do not attend or have not attended our live events, you can go to our library on our website. Kayla will throw that into the chat for a link of where you can find those webinars. So please feel free to go and watch something that you might have missed live. And without further ado, I'll introduce our presenters and we'll get started. The presenters are both experienced dental hygienists, and they also own and operate an online temping platform for dental professionals called Workco. Jade completed a diploma in dental hygiene at Vancouver Community College. She then completed a Bachelor of Dental Science and a Master of Craniofacial Science at UBC. Jade has been a dental hygiene instructor for over 7 years and currently teaches at VCC. She is the recipient of the 2013 Diane Gallagher Inspiration Award and the 2015 Social Responsibility Award from the International Federation of Dental Hygienists. And she has many years of temping experience and is excited to share her knowledge. Nikki completed a diploma in dental hygiene at the Canadian Institute of Dental Hygiene and a Bachelor in Dental Science at UBC, where she has taught for over 5 years in the dental hygiene program. She has taken part in volunteer missions to Tanzania and Cambodia. She has a wealth of experience in temping roles and loves the flexibility that it provides. She is passionate about clinical work and enjoys mentoring new grads. So without further ado, just give me one moment here as I close down my screen. Oh, just one sec. There we go. So I'm going to put myself on mute and enjoy the presentation. We'll be back live to answer your question.
Thank you so much, Wendy, for introducing us and for having us tonight.
Thank you, Wendy. Welcome, everyone. We're thrilled for this opportunity to present this webinar to you tonight. Jade and I run a platform called Worko, which you may have heard of. We have a ton of clinical experience, and we absolutely love the dental hygiene profession. We're looking forward to talking to you about clinical practice and how to make the most of it today. So we're going to cover some learning objectives. We'd like to thank those who have participated in the survey prior to tonight's session. We appreciate everyone's input. It's helped shape tonight's session. Our learning objectives for the session and what we will be focusing on include current landscape of dental hygiene practice, key concepts such as infection control, documentation, communication, employment standards, legal rights, taxes, record keeping, wage negotiations, being an employee versus self-employed, as well as common challenges in the clinical practice. A lot of what we're talking about today are big topics that we could easily spend hours on. We're going to touch upon those topics in a brief way and provide some resources for you. Just a reminder that we're not affiliated with BCDHA and do not receive any compensation for this webinar. The opinions expressed by us do not necessarily reflect those of BCDHA. Information presented is based on current scientific literature and research.
So we'll start by looking at the current landscape of dental hygiene practice. What does dental hygiene practice look like? Both from a practice setting perspective, but also considering the past year and COVID-19. There's quite a diversity of practice settings that we as dental hygienists may be working in. And I know many of you here tonight do work in alternate practice settings, so welcome to all of you. Some of those practice settings include private dental practice, both as an employee or self-employed, independent dental hygiene practice, education, public health, which includes dental hygienists that are working for health authorities as COVID-19 immunizers, long-term care, policy and government, research, and many others, which include fields like sales, consulting, associations, and regulatory bodies, armed forces, staffing agencies, and insurance. It's truly remarkable that dental hygienists are in such varied and important roles. Although we're largely talking about dental hygienists in a clinical setting tonight, there's definitely something for everybody in this webinar.
The dental hygiene practice landscape has changed so much in the last year. We wanted to spend a few minutes reviewing the impacts of COVID-19 on private practice, where to look for the most current information. Recommendations are based on BC Centre for Disease Control directives and the Provincial Health Office. The BCDHA has a document called Navigating Your Return to Work, which encompasses the most recent information. The CDHBC also provides a nice summary, which is available on their website. Oral health care during phase 2 and 3 is the most current document. It's recommended that every dental hygienist review this document. We're just touching on some of the key points today to give you a quick snapshot of some of the most important considerations. All dental offices must have an exposure management protocol in place. The protocol gives guidance to the dental office about the process that is followed if an infected individual is confirmed in the office. This usually includes 14-day isolation and contact tracing through the BC Centre for Disease Control. Screening for staff, daily self-monitoring, and for clients, screening includes a variety of questions informed by current risk factors. If yes to any screening questions, defer treatment, or if it's a staff, do not come to work. Another important aspect of screening is measuring clients' temperature. And again, we would defer treatment if temperature is elevated. PPE, masks, N95 respirator is the standard for healthcare professionals, especially during procedures where aerosols may be generated. This may be layered under a surgical mask if you choose. Gowns should be changed between patients. Gloves as usual. Eye protection includes goggles or safety glasses as well as face shields. You can get access to more information on the BCDHE website. Reminder that you can dial 811 to access COVID-19 resources as well. Changes to documentation. It's added documentation on top of what you already are responsible to document. Ensure that screening results, including temperature, are documented. Some clinicians choose to include the additional protocols that are following a part of the documentation, and this is a personal choice. It's important to consider time and efficiency as well as possible benefits of including this information. The recommendations for PPE and safety protocols are the minimum. So many offices operate based on that, but many others implement additional procedures at their discretion. So there is quite a bit of variety in what you might come across in private practice in terms of how each office has adapted to COVID-19.
Next, we'll review 3 concepts that support clinical practice: infection control, documentation, and communication. Infection prevention and control, which you'll sometimes see referred to as IPAC, is such a core concept in the dental hygiene profession and in all healthcare professions overall. Not only is it important to keep our clients safe and healthy, but it's important that we keep ourselves safe and healthy as well. We tend to get into a routine with our daily infection control procedures. So the purpose of reviewing this concept tonight is both as a refresher and as an opportunity to perhaps make some improvements to your process. So why must we follow infection prevention and control procedures? The principles of dental hygiene outline this quite well in both the practice standards and the need to practice safely, and the code of ethics, which outlines the need to ensure that any care provided upholds the health and welfare of clients, and that the care provided is done so in a safe environment. We approach infection control from a lens we refer to as standard precaution. The focus of standard precaution is prevention, and that includes strategies like hand washing, the use of PPE, like Nikki just talked about, and minimizing contaminated surfaces. So we'll quickly review the different ways of maintaining a biologically safe work environment, which you can see from this diagram. Cleaning removes soil and dirt. It's typically done for non-critical items, for example, blood pressure cuffs, and uses a low-level disinfectant. Sanitizing lowers the number of germs that are present on a surface. This also uses low-level disinfectant, and an example of this would be hand sanitizer. Disinfecting kills most pathogens except for spores, TB, and non-lipid viruses. Disinfecting is appropriate for semi-critical items, for example, a hand mirror, and it uses a high-level disinfectant such as cavi wipes. Sterilizing destroys all microbes, including spores. It's the recommended process for critical items like instruments, and there's a wide variety of different methods of sterilization, but in dentistry, steam sterilization is what you'll typically be working with. So let's put all that into practice. What does this mean clinically for us? Disinfection needs to occur at the beginning of the day, between clients, and at the end of the day. You want to make sure to first clean the surface, which is often done with cavi wipes because they're readily available in the office. Make sure that the surface is dry before disinfection. That could be a bit time consuming. One thing that we personally find works well is to clean prior to carrying the instruments away, so that by the time we return to the operatory, we're ready to disinfect for the next client. Surfaces that are more challenging to clean and disinfect because of their shape or material should be protected with a single-use barrier. Examples of barriers include plastic tubing or bags, plastic wrap, plastic sheets, and over gloves. Barriers should always be changed after every client, and the area does still need to be disinfected. The use of barriers does vary from office to office, Some might be using too many, some might not be using them at all. So it's important for you as a clinician to be considerate of the balance between using what you need and preventing waste of both your own time and physical resources. It's important to consider the time it takes to apply barriers to areas where they might not be necessary. So our recommendation is to think through your process and be critical about where the barriers really need to be placed and why. Maximizing your efficiency with turnover and the use of barriers can save you quite a bit of time between clients, and it can really boost your time management and make your daily clinical practice run much more smoothly. Documentation is another important area of clinical practice where we tend to find something that works for us and we stick to it. So let's talk about some important components of documentation that can help make a difference in your day. Our main role is to provide a treatment record entry for the clients that we see. As part of that treatment record entry, some of the key areas include a statement of informed consent or refusal. Some offices use a form for this, particularly for informed refusal. It is best practice to have the client sign a disclaimer if they're refusing treatment or radiographs. If your office doesn't have a form, it's important that you document this information in your treatment record entry. The dental hygiene diagnosis is another important part of your treatment record entry, and it should include an AAP statement that reflects your assessment findings. The AAP guidelines were last updated in 2018, and they're now using a staging and grading system of classification. We won't go into detail about the AAP update here. However, if you'd like more information, in our opinion, the best resource is actually a great webinar from the CDHA about the AAP. It's an hour-long session. It's available online until July 22nd, and it's free for CDHA members. Some tips to be efficient with your documentation. We recommend completing your entries towards the end of the appointment. For example, while waiting for an exam, and if needed, taking some time at the end of the appointment to finish up. This is ideal so that the information is still fresh in your mind rather than waiting until the end of the day to do everything. That ends up being really time consuming. If you're in a pinch, you can jot down the most important information and plan to come back to the rest later on. Another good tip is to complete part of the entry in advance. For example, I typically have a few different templates that I like to use, and at the beginning of the day, I enter them for every client on my day sheet. This is also when I look through previous entries to make sure that I'm up to date and following up on anything that was noted previously. Another good time saver is to copy and paste. For example, you can copy the previous entry and update the areas where there are changes today. In terms of documenting perio findings, this can definitely be quite time consuming. Try to make use of the help that might be available to you. For example, someone who can help you enter the numbers. Another simple but valuable tip is to memorize the numbers for several surfaces at a time before going to the computer to enter them. This will save you from going back and forth for every single measurement. You can even use hands-free voice charting if your software has this feature available. So these little tips can really save you quite a bit of time. Make sure that you do dedicate a few minutes to updating the perio chart for every client. Your assessment findings support your diagnosis and your treatment, so you must ensure that you're maintaining a current perio chart for the clients that you see. I do want to add that there'll be times where you'll walk into an office and no one has touched a perio chart ever in that office. That makes your job a lot harder because instead of updating, now you need to start from scratch. Don't be that person who doesn't chart. Take that opportunity, set some higher standards, and lead by example. It's also important to remember that documentation actually falls under scaling units if the client is in the chair. This is another reason to make good use of your time while waiting for an exam, or if your client runs to the washroom. Use that time to start writing.
Communication is also such an important component of your clinical practice, both communicating with your colleagues in your workplace and also communicating with your clients. With colleagues, it's important to know a few things prior to starting work, whether this is on a temp basis, working interview, or a permanent job. Try to find out the office's expectations, especially in terms of your role within the office. The best way to meet expectations is to know them in the first place. Some offices have morning staff meetings or regular hygiene department meetings, which are a great way to make sure that everyone is on the same page. It's important to also have some conversation about radiographs. There should be some discussion about frequency of radiographs and considerations like perio for the dental hygienist and consideration for caries for dentists. Practically speaking, it is also helpful and it makes the day go smoother when you know how to seek a dentist for a recall. The practice may also have several dentists and they may have different preferences. Communicate with the dentist in your office to find out how they wish to proceed with the recall exam and what kind of notice they would need for recalls. Lastly, it's also important to understand how an office typically handles recare intervals for their clients. For example, if you see a client who typically has been coming in for every 6-month recalls, but really needs to be seen every 3 months, how does the office handle insurance consideration? We should discuss the interval and what caused the change in the interval so that the client can make an informed decision in case they don't have proper coverage. In terms of communicating with clients, introducing yourself to clients is very important. Tips on introducing yourself as a temp when the client may have been expecting their long-term dental hygienist. For example, hi, my name is Nikki. I'll be your hygienist today. I'm filling in for Jessica, who is on holiday. It's very nice to meet you. Please feel free to ask me any questions along the way. Try something short, friendly, and caring. A gentle approach will help someone who is uneasy to feel more comfortable right away. After introducing yourself, it's a great time to ask about the client and what they do for work or what they do for fun, etc. Clinical findings. It is important to discuss clinical findings thoroughly with the client, including assessment findings such as extraoral and intraoral exams and discussing dental hygiene diagnosis. Informed consent. The key point here is informed, and the client needs to be well informed in order to consent. Consent includes discussing assessment findings and discussing the dental hygiene diagnosis as well as the cost of the treatment. Oral hygiene instructions is often the first thing to go when we run out of time, yet it is easily one of the most important components. Discuss how client education ties in to each aspect of the ADPI process. Assessment, client education about your findings. Diagnosis, keeping the client informed plays a key role in motivation. Give them a chance to ask you questions. Planning, ensuring client understands the treatment plan helps set expectations for their care. Implementation, showing client your progress, especially heavy deposit stains, perio status, etc. Evaluation, discussing a plan for follow-up and for the personal care at home.
Next, we'll look at employment standards, including legal rights, taxes, record keeping, as well as wage negotiation. The Employment Standards Act is the law in BC that sets standards for working conditions. It essentially outlines the minimum that's required by law of employers. You have many rights as an employee, and for more information, we do recommend accessing the Employment Standards Act online for information that might be relevant to your particular situation. We do want to touch upon a few of those rights and talk about how they relate to dentistry and dental hygiene. Overtime is required to be paid unless agreed otherwise, for example, in a written contract. I think we can all agree that not having overtime paid is a pretty common issue in dentistry. If you're not being paid overtime, you should have a discussion with your employer. Most employers aren't intentionally breaking employment laws, so the first step would be to bring this to their attention. If you do approach your employer about overtime and they refuse to comply, we suggest contacting the BCDHA for support and guidance with the next steps. Statutory holidays and vacation pay are also required by law to be paid. Severance is also required to be paid unless agreed otherwise. Long-term employees may be entitled to quite a bit of severance pay. If you have any questions about a situation that you're in which does not abide by the law, BCDHA employment guidelines are there to support you, and you can also contact them directly for support. An employment contract is an agreement between the dental hygienist as an employee and their employer. Contracts aren't required, but they can be very beneficial. Their purpose is to set out the terms of your employment in a written agreement. Verbal agreements are viewed as a contract as well, but having the details agreed upon in writing will keep expectations clear and can prevent confusion or problems down the road. An employee contract should contain information like the start and end dates, legal names and contact information, and general duties of employment. It should also outline remuneration. We definitely suggest setting some guidelines about possible wage increases. For example, agreeing to reassess your hourly wage at a regular time interval, whether that's every year, every 2 years, whatever you might agree upon with your employer. You'll also need to update the employment contract. And of course, make sure that you do read and understand the contract prior to signing it. If you're being asked to sign something that you don't agree with, you can choose not to sign it. You can find more information about contracts on the BCDHA's website in a document called Guide to Employment Contracts. Employees typically have standard deductions made from their gross income, including the Canada Pension Plan, employment insurance, and federal and provincial taxes. There are some important tax considerations if you're working in multiple practices. For example, if you're doing a lot of temp work. The amount of tax deducted from your pay is based on your estimated income for the year. In a case where someone works in 2 offices, each of these offices is under the assumption that your income for the year is based on your work in that office. So in that case, 50% of your actual income. The proportion of tax that's due, which is also called a tax bracket, is directly related to your income. So the higher your income, the higher the tax bracket. The issue with working in several offices is that each office is remitting tax in a lower tax bracket than what you actually owe at the end of the year. There's 2 possible solutions for this. The first one is simply account for the difference yourself, set some money aside from each paycheck to cover the cost that'll be due when you file your taxes for that year. The other solution is to discuss this with your office. You can request that they retain a greater amount in taxes from each paycheck. This is a fairly easy process and most offices are happy to oblige. Lastly, we do want to remind you that you're responsible for keeping your tax documents for 6 years after the time that they've been filed.
When it comes to record keeping, it would be helpful for one to keep clear and concise record of their hours, wages, dental hygiene production over time, which could aid in wage negotiations later on. For those that choose to temp, this part is imperative as it will help collect data for tax purposes. Information is power, so remember to keep a clear record of all your information. What proportion of what you bill is fair compensation? When self-employed and paid by production, a typical range of compensation is 30 to 40% of what you bill. This can be a great point of reference to determine your value. Knowing what you bring, the right hygienist is an asset to the practice beyond just dental hygiene treatment. Their role encompasses client education related to dental treatment planning, client rapport, client retention. Dental hygienists bring revenue to the office from a business perspective, contributing to the bigger picture. For example, if the client needs a root canal therapy, education and understanding is often key, and the dental hygienist is the one that can educate the client in detail. Now we're going to be talking a little bit about our current wages. A good way to keep in the loop is to chat with colleagues and friends and stay informed. You can also refer to the 2019 CDHA job market survey for support regarding wages. Please remember that the survey is already 2 years old and the wages are continuing to rise. From the market survey, we can see that 88% are employees and are paid hourly. 30% of respondents did not have an increase in pay over the previous 2 years. The average wage was $46 an hour in BC. The average annual income was $65,000 per year, and 25% have health benefits. Anecdotally, we know that the wage is much higher. Jade and I run a staffing company, and the wages that we see across the Lower Mainland are closer to $50 to $55 an hour and up from there depending on experience. Please note that a yearly review with your manager or boss can help you understand what you can do to improve yourself as well as grow in the practice. This can help shape wage expectations and advocate yourself by highlighting your strengths and contributions to that office. Some tips that may help you in discussing wages may include picking a good low stress time to talk, coming prepared with a list of most important points and things that set you apart. Also not forgetting to negotiating benefits such as sick days and holidays as you may feel deserving.
So as Nikki just mentioned, the CDHA's job market survey tells us that 88% of dental hygienists in BC are employees, and about 5% are self-employed. Most of us probably don't know what the difference between the two entails, but it can be a very important distinction, especially when temping. It's important to know if you're considered an employee or self-employed, so we're going to briefly review the two. Most dental hygienists are employees. This is the traditional contract of services where you typically work in one practice. The working hours are set for you and you work on an hourly waged or fixed salary. You're compensated for failed appointments and your employer is responsible for remitting taxes. You also may get group benefits, insurance, vacation pay, or bonuses. A self-employed dental hygienist is often referred to as a contractor. Their basis of their work involves a contract for services. They may work in multiple practices and settings. They're in charge of setting their own hours, and they have a productivity-based compensation. So like we mentioned earlier, it's typically a percentage of what is billed. They are not compensated for failed appointments unless there's a contract in place that says otherwise. And the same is true of providing their own equipment and overhead costs. And they're also responsible for remitting their own taxes. The main advantages of being self-employed are the freedom and the flexibility of the schedule, choosing your own hours and your work settings, as well as the ability to make deductions from your income tax. Some disadvantages include a lack of traditional employee benefits, as well as the financial risk that's associated with being self-employed. There's the potential to be profitable and successful, but there's also the risk of losing money. So being self-employed can be a big risk, but it can also be very rewarding. Next, we're going to talk about some common challenges in the workplace, such as issues with equipment, lack of support, and procedures in billing, and how to handle those challenges. We'll also be talking about ethical dilemmas and a little bit about the reporting process.
Issues with equipment may include faulty or broken equipment or those that need maintenance. To overcome this challenge, it is important to expose yourself to a variety of equipment from the beginning. Report any equipment that is faulty or not functioning or needs repairs. Some basic troubleshooting can go a long way. For example, if you're experiencing issues with the Cabochon, there are a number of things you can try before calling someone, such as seeing if the water bottle is empty. Is the water turned on? Did you remember to purge the water before inserting the insert? Other challenges that you may run into may include not having enough clinical instruments or instruments of your choice, or working with inadequate or dull instruments. For these, try to plan accordingly. If you only have a few sets of instruments, make sure to stay on top of sterilization. If instruments are dull, try to be flexible. Do your best to sharpen some of the instruments, keeping in mind that this can be time-consuming. Whenever possible, consider changing the tips or ordering new instruments. Lack of support from colleagues. It's helpful to know who to ask for help, but sometimes there really isn't much support available as a temp. Try to find answers on your own as much as possible and be brief and ask questions if you need to. Having a list of things you need prior to starting your first patient will help you throughout the day. For example, you may need to know where the necessary items are, such as PPE, goggles for patients, bibs, instruments, prophy, slow speed, ultrasonic tips, types of fluoride that office uses, oral hygiene aids, toothbrushes, and giveaways. Those are just to name a few. There is often a lack of support in terms of poor client records and previous documentation. For example, substandard documentation not containing enough detail, or lack of probing history. It is your responsibility to correct this going forward so that the client can get their dental records up to date and the best care possible. How to overcome this challenge. If you have a sequence to your appointment, you will notice that your time management skill will improve drastically and your day will go smoother. Be sure to maintain a high standard of professionalism for yourself, including completing perio charting and ensuring your entries are complete in full and can be useful for the next clinician.
Another common and very important challenge is with procedures and billing. For example, the time that is being scheduled for you to provide treatment. An example of this is that some offices have now gone back to a regular schedule of 1 hour per client, despite the added COVID protocols. That doesn't really leave enough time for all the procedures that typically need to be done. It's important to have a conversation with the front desk staff if you find yourself in this situation and try to come to an understanding. Keeping in mind that if they're unable to give you more time, you might be unable to complete the procedures and you might need to bring the client back to provide adequate care. Fraudulent billing is also a fairly common issue. A basic example of fraudulent billing would be entering the treatment you've provided and seeing that someone else has actually changed the procedures, usually to increase scaling or replaning units. Another example would be an office asking you to bill 4 units of scaling for a 1 hour recare appointment, where there was also an exam, polishing, and fluoride done. The units just don't add up, but some offices will try to pressure their staff into going along with that. The first step should be to bring this to someone's attention in a very clear and direct way. They may not be aware that what they're doing is fraudulent, or they hope that you won't call them out on it. So asking them about it directly usually resolves the situation. This is actually a great way to bridge into our next topic, which is ethical dilemmas in the work setting. What should you do when faced with an ethical dilemma? It's a situation that each of us hopes never to be in, but unfortunately, these types of situations do arise, and we want you to know that you're not alone. You always have support available to you in these difficult situations. The BCDHA can be a great resource, and the CDHBC Code of Ethics can also give you some direction and some useful information. So we want to touch upon a few of the most common ethical dilemmas. What to do when an office doesn't follow protocol? Do you follow along or challenge the status quo? It's important to know your professional standards and abide by them as much as possible. And don't hesitate to ask about the office protocols if they don't seem appropriate. Sometimes it can just be a misunderstanding, but if it isn't, sometimes just talking about it can help alleviate the situation and correct the issues. We do want to add that if you're temping, try to be accommodating. Keep in mind that this office has likely operated this way for a long time, and they might be a bit resistant to feedback and to change. Try to focus on approaching issues from a respectful and professional place. What do you do when a client's best interest is not prioritized? For example, if the care provided is not individualized, what about poor quality of dental work and just bad dentistry? Do you let the client know? Do you document it? Do you report it? Do you initiate a conversation with the person or people involved? These are all important considerations, and ethical dilemmas are something that's innate and personal for each of us, and we can have some push and pull in different directions depending on the situation. We always suggest having a conversation when you're faced with an ethical dilemma, whether that conversation is with the person involved directly, with some of your friends or colleagues for support, or even with the association for professional advice. Having these conversations will provide a network of support for you, and we really encourage this to be your first step. Dental hygienists have a duty to report professional behavior that's not in the best interest of the client or the public, and when there's a blatant lack of competence. Keep in mind that most issues, like we said, can be resolved without the need to report. Somebody might simply just not be aware of the mistakes that they're making, and most people will appreciate you bringing this to their attention. The reporting process is not anonymous. There's no standard of proof that's required to file a complaint. You must write a written complaint to the appropriate regulatory body, for example, the College of Dental Surgeons or the College of Dental Hygienists. The complaint then goes to an inquiry committee that's within the college for review, and a decision is made about the outcome, which might be discipline, remedial action, a fine, and so on. I'd like to mention as well that our duty to report goes beyond just these types of issues, and it also includes the duty to report in regards to sexual misconduct in the workplace, as well as a dental hygienist's professional duty and legal obligation to report suspected child abuse to the Ministry for Children and Families, as well as suspected elder abuse, which should be reported to your regional health authority or to the police. You can find a lot more information about these topics on the CDHBC website. We'd like to wrap up our presentation with some words of wisdom. We want to highlight some of the words that we've collected from many of you through our online survey. Be comfortable introducing yourself.
Bring a plan for food, snacks, and water.
Don't hesitate to ask for help.
Ask lots of questions and learn as much as you can.
Know your scope of practice inside out.
Stay in the moment, be positive, and have fun.
And protect your ethical values and standards. And for new graduates, we've got some great recommendations from some experienced clinicians. We're going to read some of the comments here. Use your 11-12 Explorer to check every surface of every tooth, even if you're confident that you've thoroughly scaled everywhere. Every hygienist uses them, especially when new and learning. Temping offers a wide variety of experiences that can help you decide how you want to work and teaches you to be flexible in the workplace. You may not get all areas completed at once, but you can bring the patient back. Have a few working interviews and temp before settling. Learn more about the dental team to be more involved. Realize that the learning curve is steep. Things will get easier. We hope that these can be helpful to you and that someday you'll be the one to pass along your words of wisdom to other new grads. So in summary, the content that we've reviewed in this webinar is obviously very important and directly supports your success in clinical practice. We truly do hope that the content of the webinar has been helpful to you and useful to your daily practice. We'd like to end by connecting what we've talked about so far tonight to some overarching concepts. Please remember to maintain your professional standards in all that you do. These should really guide you in your decision-making process and provide a framework for you. Be sure to advocate for yourself, not just as a professional, but as an employee and as a colleague. Don't be afraid to speak your mind and to stand up for yourself if you're ever in a situation that challenges you. We know that doesn't come easily to a lot of us, but using your voice to effectuate a positive change is so important, especially for yourself. And lastly, always remember that you are skilled, you're knowledgeable, and you're so worthy of a fruitful and happy career. You're part of an amazing profession, and you bring so much to your practice setting. You should really be celebrated for that.
Thank you so much for joining us on this webinar. If you'd like to know more about Jade and I or our business, please visit our website, worko.ca, or email us at info@worko.ca. Please note that if you'd like to view any part of this presentation, including our references, a slide handout will be made available to you after the session. I know we have a few minutes left for questions. Wendy will be starting a Q&A portion of our presentation now.
Hi, Nikki and Jade. If you want to pop on your, sorry, I'm just going to get rid of our great, hi there, ladies. Thank you for that wonderful presentation. There's certainly some great nuggets in there. I'm sure that members that are online right now can go, yeah, I should do that tomorrow when I go to work, or next week. I should be doing that because that might certainly help. Because we know that we, most often we're working and rushing around at 1,000 miles an hour all the time. So even, and I know when I used to teach, I used to tell students that, minutes and hours are made up of seconds. And if you can save a few seconds here and a few seconds there, it adds up at the end of the day, for sure. Absolutely. Thanks for the plug so much. You mentioned BCDHA and the support that we can provide members. And I have to say it's so important. Jazz that you met earlier, Jazz has just come on, and a fair amount of the questions and concerns that we hear from members is about employment conditions, and some of them are very concerning. Some are easier to settle than others, and some can be very complex. And we do take that environment very seriously, and that's part of why we're bringing on more practice advice. We've actually hired 2. So Jazz will be slowly taking over the employment section from my portfolio to give me some more time to devote to other areas. So we do have a new email, and Kayla, if you could throw that into the chat. I know it's practice supports, but I don't know exactly how, if there's a dot in there or something. So people can certainly send questions for us to assist. The other thing I wanted to mention is that CDHA is launching their every 2 years they do their job market and employment survey, and that should be hitting in your inboxes here shortly this fall. Please make sure that you complete that. The data that we have about wages and employment conditions is very, very important, and that's that's really foundational information we need. And anecdotally, we're hearing that wages are going up across the province. And like just even recently, I was approached by an HR person in a dental practice, and they're looking at our data for what is the what's the going rate to hire a hygienist in their particular part of the province. So please, please, please fill that information out. It's very vital to us in terms of assisting members going and dialoguing with their employers when they want increases in benefits or salary. And I'm just going to grab a drink of water here. And the one thing I really wanted to, I don't think I've told you guys, I had a hidden agenda for having you guys do this webinar for us. It's great information you give us, but the work that you guys are doing in terms of bringing in an application to the working place to make things easier for people who are temping or want to temp, making it easier for dental practices to access people who want to work. I think it's phenomenal. And I really see the association being a place where we can help highlight some of the wonderful work that you guys are doing outside of dental hygiene practice. Because dental hygienists are doing really cool things out there. And I always say, I talk with Azul Kanji from UBC often, and I say, hygienists we need to see ourselves there. If we see ourselves there, other people will see us there too. And, here you guys are, not only are you clinicians and great dental hygienists, but here you are building a business and doing things that dental hygienists don't normally do. I think that's really cool. And thank you for coming and sharing with you. And I'll leave the rest up to you guys to answer the questions I see coming through the chat and the Q&A. So thanks very much. I really appreciate it.
Thanks, Wendy. Yeah, it's something we're not talking a lot about in this webinar, obviously, but we do run our own business and we love it, and we've had an amazing experience with it. And if anybody has questions about that, we're happy to answer that as well. However, I see so far lots of the Q&A has been related to our webinar session, so that is very good. But just wanted to thank you for mentioning that, and that we are always open to any questions about that. We're happy to chat with anyone who's considering starting their own business or who already has maybe. We're always happy to hear from you. So just wanted to mention that. So I think Nikki and I will go through the Q&A that we've got here. We'll start from the top. It looks like some have been upvoted. So the first question, what should be done to clean the lead apron between patients? The one that I use has a material that's not able to be wiped down. Nikki, I think, is happy to speak to this question.
Yeah, I would say that to clean lead aprons would be any basic disinfectant like Cavicide on both sides. But if you have something like a corduroy material, which I've seen in offices on one side, there's really no way of wiping that down. You could put a plastic barrier like on the patient and then put the lead apron on top of that, but it just might not work very well going around the neck area. It's probably best that you ask your employer to purchase a new lead apron that's wipeable on both sides. That would make most sense.
Yeah, especially
COVID times.
Yeah.
Awesome.
I hope that answers that question well. The next question is from Janelle. In regards to statutory pay, do you need a certain number of hours in order to qualify to receive it, or is it mandatory by law? This is a great question. It is based on how much you've worked over the past 30 days. So you'll receive statutory pay for stat holidays if you've been employed for at least 30 days before that stat holiday, and if you've worked 15 of the 30 previous days. So it just depends on your workload in that office. And the pay that you'll receive for that stat pay is an average day of work. So usually the office will average out how many hours per your typical work day. Is that right, Wendy?
Yes, there are requirements around statutory pay, unless your employer, now keep in mind, your employer can certainly pay you for statutory days, even if you're not eligible for them. Again, that really depends on whether or not you've negotiated that part into your salary. So again, the employment standards guidelines or rules around employment really are the minimum. So your employer certainly could choose to do that. The other thing too is if you, so lots of offices, I mean, we know that dental hygienists have a difficult time sometimes finding full-time employment in one office if that's what they want, versus, you know, they might work 2 days a week here, 2 days a week here, 3 days a week, you know, kind of hodgepodge. So if an employer has, let's say 3 or 4 hygienists that are all working part-time and not eligible for the statutory payments, they may be getting away with not paying any. And that's really not fair. So again, that would be something that I would certainly approach the employer and say, well, if I'm not getting stat pays, maybe then I should be getting another $1 or $2 an hour or another benefit.
Absolutely. We do have another comment from Christine just below that says, if you have an averaging agreement, you do not have to have the acquired number of days to qualify for the statutory pay. And that makes sense. The averaging agreement would be an average, is it per week, Wendy, of working hours within a week?
Yeah, I think it's 7 days. The averaging has to occur, and I mean, it's way beyond the scope of this particular webinar. If your employer is approaching you to sign an averaging agreement, there's lots and lots of rules around it, and they have to follow them very strictly for the averaging agreement to be held in place. So please reach out to us or check online with employment standards about an averaging agreement if you're being asked to sign one.
Thank you, Wendy, and thanks, Christine, for mentioning that.
Yeah, I'll keep with that question here, Jade. Another question on the other side, I can see due to COVID, cancellation has been quite common nowadays. Is it in the Employment Standards Act that you're entitled to 4 hours of pay even if only 2 clients came? So yes, that is true. You are entitled to 4 hours of pay even if you just worked on 2 clients. Along with this, if you showed up to an office that sends you back home because they double booked you or something like that, you are entitled to get paid for 2 hours of that time not working.
Thank you. Good. Then we've got the next question. I'm just working off of the Q&A, and then maybe we'll pop into the other chat to double check after. It seems like there's a lot of messages in there. We'll just have to sort through. Yeah. This is from someone anonymous. It says, does infection prevention and control require double wipe only for visibly soiled areas or all surfaces? Great question. We definitely would recommend that you do wipe all, so double wipe being the cleaning and then the disinfecting, and that would be important to be done for all surfaces. So the IPAC requirement is that all surfaces be disinfected and cleaned prior to starting work, after every client, and at the completion of your workday. So those are the recommendations that we would make as well. And the next question from Diane. What is the minimum PPE and follow time requirements? I think that's just asking what the minimum PPE is. I hope that's your question, Diane. Nikki, did you want to answer this one?
Yeah, I mean, the minimum PPE is what we used to wear in the first place before COVID happened. So gloves, masks, and eye protection would be the minimum PPE. The additional protocols are, face shield, gowns, N95. Those can be added on top of that. So yeah, we should have maybe clarified that, but yeah, minimum is what we used to wear.
Yeah, can I just jump in there, ladies?
Yeah,
the colleges, the regulators in BC have taken I'll call it a very hands-off approach in that they're leaving the essentially, like, for instance, do we have to wear a level 3 when we do X, or can we wear a level 2, or is a level 1? And really the college, I mean, that's obviously, it's a regulatory issue. The college really needs to speak to that. But in essence, kind of a summary is that they're really leaving it up to the individual professional practitioner to determine, you know, what is the PPE, what is it built for, or what is it designed for, and what is it that you're doing with it in terms of practice and staying safe. And that's really being left up to the practitioner. So a very different approach than in some provinces, and we appreciate that in one sense. And I think some of us would prefer that there would be more, you know, a little bit more rigidity in that in certain employment situations. So
Yeah, I agree. Thank you, Wendy. The next question we have is from Mejabin. I hope I'm saying that correctly. The question, which is a great one, when you know in your office the fellow hygienist is fraudulent billing, for example, doing fluoride rinse, but billing for fluoride varnish, seeing a patient for 45 minutes, but billing for 3.5 units scaling, plus polishing a fluoride and recall exam. I think the question is kind of saying, you know, what do you do when that happens? And that really speaks to that ethical dilemma that we were touching upon. The first thing you would want to do, in my opinion, would be to inquire, you know, is that person doing that on purpose? Do they realize that they're, you know, billing for more time? You know, is it even them who is billing those things? Sometimes the receptionist might be changing the billing. So there's lots to be investigated. So I think the first thing to do would be to touch base with your colleagues. From there, you can make some decisions as to whether it's worth reporting or not. So again, we touched upon the reporting process, but sometimes that is the answer. So, you know, don't shy away from going that route if you feel that that's what's required. Great question. Thank you. Our next question, if a client is scheduled for an hour and you did 50 minutes of scaling and root planning, polishing for 5 minutes, fluoride and recall, how will you build this scenario? That one seems a little bit complicated. Any thoughts, Nikki, on this one?
Yeah, I mean, I believe we had talked to Wendy about this as well. The scaling and root planing, also you can bill for taking notes during that time. So if you have taken notes additional to the 50 minutes, then you can bill for that. So if you weren't taking notes within that hour and you were doing notes on your lunch hour or whatever, then you cannot bill for the notes part of it. So here, if you were just billing, you would be billing for 3.5 units or 50 minutes. Yeah, that would be about 3.5 units of scaling, root planning, yeah, and then polish fluoride separate and recall.
And I think that that's okay because you mentioned in your question that you are dismissing 5 minutes late. So it does make sense that you'd bill for a little bit more, you know, time-wise, you know, spending 5 minutes on polishing fluoride and the exam. If you're dismissing 5 minutes late, you do have a little bit more time that you're working with, it looks like. And Erin is adding a comment. It is important to document that you ended the appointment late when that happens. And we absolutely agree. Document, document, document. Absolutely. That way, if there's ever a question, if the client ever does, you know, call and say, oh, this is strange. I had, you know, more scaling units than I've ever had before. What happened? Why am I being billed this way? You can easily look back at the treatment record entry and see that, you know, you did take more time in that case. So great comment, Erin. Thank you. Our next question is from Silka. She says, in the office, if the office only provides level 3 masks, how can you ask for N95? How do you go about asking the dentist or office manager about this? Any thoughts, Nikki?
I think if you feel safer, at the end of the day, it's up to how you feel, and you should speak up. I know we don't want to rock the boat a lot of times with our employers, but it is important to speak up if that makes you feel safer to ask for N95, and I'm sure they would be attentive to that because overall your safety is important as well.
Yeah. Thank you.
And safety of the patients as well. I guess it's both ways. So
absolutely.
you should feel comfortable at work. So yeah, just speak up about it.
Thank you. The next question says, you mentioned the average wage nowadays is $50 to $55 an hour. Is this for temping or regular positions? And Bronwyn has added, this is generally for regular positions, but depending on what area in BC that you work. I mean, as you all know, we do run a temping platform, so we do see everyone's wages and the shifts that they work. So we do see the areas and we do see the wage. I definitely think Nikki and I would say that 50 to 55 is a little bit on the lower end of the spectrum now. We're looking forward to seeing what comes of the CDHA job market survey, because we're curious to see just how high that will be reflected to be. But 50 to 55, definitely for a regular position, temping, upwards from there, based on your experience, upwards from there. And Bronwyn makes a good point, depending what area that you're working in as well. Downtown Vancouver tends to charge a little bit more, or areas that are quite far away as well and require a long commute. You can ask for a little bit higher wage for those as well. But everybody lives in different areas as well, so not everybody is commuting the same way either. So it's important to keep that in mind too. Anything to add, Nikki?
Yeah, I think I would add one more thing is the wages, it's based on what you feel you deserve as a wage as well. Your clinical experience, your years of practice. I think that's really important. So again, advocating for yourself and really writing down what are the skill sets that you have that others may not at that office or at any office that you can provide. I think that's important to address. It's not so much on just location where it's based out of. It should be also based out of your work experience. What you can give to that office. Yeah.
Benzie has a great follow-up question that says, what should the lowest pay be in BC? Wow, great question. I mean, we haven't discussed this beforehand, but I would venture a guess that I haven't seen a wage lower than 50 in several years. What about you, Nikki?
I have. I think when it comes to new grads, I see that there is a bit of a lower pay in terms of, I've seen like 46, 48 at that level, because they are, new and just getting accustomed. And I think once they have some experience, they can certainly advocate that as well for themselves.
Yeah, and I think a good tip, if you are a new grad and you know that you'll be working potentially for a little bit of a lower wage initially, it's a great idea to follow up within a few months, to make that plan right away when you take a position, to have your wage reassessed within a few months. That's really a great approach, so that there's some clarity as to your wage expectations. If you take a job for a little bit of a lower wage as a new grad, you don't want to be stuck with that wage if you do know that you deserve more. I'd like to ask Wendy if she's got something to add.
Yeah, sorry, I have a hard time not talking. It's a character flaw, I'm sure. On the BCDHA website, we do have the summary, the executive summary from the CDHA survey, as well as in 2019 we conducted our own wage survey and had a very good response, and it breaks it down by years of being a dental hygienist, as well as area and location. And yes, there's lots of hygienists in terms of average in the 40s, mid to upper 40s, and again, depending on the area that you're in, like Prince George has historically been a lower salary, like lower wages area, and some places in the interior are higher. So, it's kind of all over the map. And I see there that, thank for that. Somebody said about us old gals that have been around. Sorry, gentlemen, if somebody's saying that. Yeah, and Margaret, I see that practicing for 45 years and not had a raise in 10 years. Like I when I hear stories like that, and I hear them, not all the time, but they're often enough that they're concerning. I think I've even talked to a hygienist who worked for 18 or 20 years without a raise. And my first question is, oh my gosh, how did you let that happen? And if I was an employer, I'd be embarrassed to admit that or let that out into the public. So really, there is no one else that's going to go out there and advocate for you. You have to be able to do it yourself. And if I was one of a hygienist in a practice that hadn't seen a raise in 5 or 10 years, I'd be knocking on their door saying, what the heck? We need to relook at this for sure.
Absolutely. Yeah, that's a very long time. And things change so much in that amount of time. It's, cost of living.
That's a lot of money. That's a lot of money that's been lost. Yeah.
Yeah, absolutely. I'll try to keep working our way through the Q&A. We were meant to finish for 8 o'clock. Are we wanting to take a few more questions, Nikki? And maybe we'll do the remainder by email perhaps or something like that?
Yeah, people are yes, it is after 8. Thanks for the reminder there, Jade. So I know that people, we actually put it until 8:30. So if people want to hang around, I mean, obviously we're not going to chain you to your desk or your computer, but if you won't need to go, we completely understand. And if you guys, it's up to you guys how long you want to, I'll hang out here all night with you, but I'm sure you probably don't want to do that. You let me know when you want to stop.
I think, why don't we take 5 more questions? We'll kind of look through these and take 5 more on.
Sure.
And any remaining ones, we'll be happy if we don't answer your questions. Please send us an email. I'll add our email address into the chat again. And please just send us a quick email and we'll be happy to chat with you guys directly about any questions you've got.
Thanks, Jade.
No problem. Another question from Silka. How long should you wait to ask for a pay raise? My contract mentions no interval time of when raises would be discussed, but it is included. I took the wage considering I'm a new graduate and therefore did not ask for more, thinking I could renegotiate after the 3-month probation. That's a little bit of a tricky situation because now we've got a contract scenario. But as you mentioned, Silka, there's nothing that says when you can reevaluate that wage. We would encourage you to have that conversation with your employer. Again, as we discussed in the webinar, it's great to do a little bit of research first. So to see, what your typical production is like, really come prepared, ready to talk about what you bring to the practice and to have that be, your asset. So do chat with some of your colleagues and friends, see what the typical, wage increase that you'd be looking for would be, and go into your discussions with an idea of what you would like that wage to be, obviously. You're just mentioning, would 3 months be too early or wait until 6 months? 3 months is a great idea, especially if you wait 6 months, the answer might be no. So you'd prefer to go with 3 months. And at least if they say, let's discuss it at 6 months, at least you've had that conversation at 3 months. So I would strongly recommend to discuss it after 3 months. And 3 months in one office is a while. So that's still a significant amount of time. They've had a chance to enjoy you as their dental hygienist and to see what you're capable of and what you bring to their practice. So the 3-month probation is a good time to discuss those things. That would be my thoughts. Thanks, Silka. The next question is, are employers required to pay for the setup and cleanup time? Did you want to speak to that one, Nikki?
Yeah, sure. Typically, they do pay 15 minutes before and 15 minutes after. I know in my case, they've always paid that time for just setting up and cleaning up at the end of the day, finishing your notes. There are some employers that are a little more generous. They give you all the time you need. If a patient is behind and then you end up running behind. So yes, they generally do pay for setup and cleaning up about 15 minutes on either side, and sometimes into lunch as well. So I think that's something you need to ask your employer if you wanted more clarification, because it's really up to them.
I think, go ahead, Wendy.
Yeah, actually, you know what, the rules around employment are, if the work is required, so if your employer requires you to do work, then they must pay you for that work. Mm-hmm. So an example would be in one practice I worked at, my employer, even though I didn't want it to be that way, said when I was finished my last patient, I did my notes and then I left, and then the other staff had to clean up my room, which means I was not then required to do that work. Therefore, she was not required to pay me for it, but someone else did that work. So it would not be permitted to be acceptable if they required you to do the work, but then didn't pay you for it. So if you do work, they are required to pay you.
It's very well put. Thank you, Wendy.
Yeah, them's the rules.
Yeah, absolutely.
Yeah.
Wonderful. The next question, does the employer have to pay vacation accruals if you request them but aren't taking vacation? Meaning, can you request the vacation payout at any time or only when you're taking holidays? I do believe that you can. Nikki and I have talked about, we've both done this before, but I guess a good question for Wendy would be, is the employer required to pay out, or is it just that they may be willing to do it?
Yeah, you know what? To be quite honest, I don't know the answer to that question. I know the answer would be you have to have earned the holidays first. The employer doesn't have to pay you out in advance. But I really don't know about that. I'm not really sure, so I don't want to comment.
Okay. Yeah, and you know, anecdotally, Nikki and I have both in the past have done that. So maybe that partially answers that question. So we don't have the definitive answer. We're not sure if they have to, but they certainly can. So it can't be to ask.
That's well put.
Thank you. Our second to last question will be from Sarah. Would working in a perio specialty practice pay higher than a general practice dental office? Very good question. Do you want to speak to this one, Nikki?
Yeah, sure. Typically, yes, but not always. So it is up to you to, you know, again, advocate for yourself. And if you're working in a specialty office, if you have special modules or you've taken some courses, many other instruments you can use at a specialty office, and you know how to use them, and you will utilize all of your skills in an office differently in a specialty office, then yes, you should definitely ask for what you deserve, but I don't think it is a mandatory thing. Jade, do you know anything about that?
I don't think it's mandatory. I think it, you know, it requires a little bit more experience oftentimes because there's, you know, you're seeing lots of deep pockets, lots of involved perio cases, so it does require some experience and some expertise, so some advanced skills. But no, I don't think it's required to therefore have a higher wage. Yeah. Good. And the last question that we'll take from Linda, how can dental hygienists get practice on the myriad of dental software programs? Can you point us to workshops, or would you be able to present something around this? I mean, we'd be very happy to present something about this. I mean, I'm sure that between the two of us, Nikki and I, have probably seen every software program out there. So that would certainly be something we'd be interested in. We definitely could look into doing that. Shelley has added, you can go online to some sites and they have some training available. Another thought would be on YouTube. There's usually quite a bit there. Sometimes, you know, institutions like colleges and universities will post or use things through YouTube. So there might even be some useful demos and things like that. So Linda and anyone else who's interested to get some more information about dental softwares and some kind of training around those, I think YouTube would be a great place to start as well for those. Great. I think that is the additional questions. If anyone else has any questions that we haven't gotten to, again, please do send us an email. I'll just add our email into the chat again so that you can send us an email if you'd like. That'll be in the chat. You can also refer to your handout for our email address. It's towards the end of our presentation. You've got our contact information there as well. Great. Well, thank you so much for joining us. Sorry, Wendy.
Oh, I was just going to thank you. Thank you both. Thanks, Jade, and thank Nikki. I think it was a really, really great overview. I'm sure we could have spent several hours answering all the questions. So please feel free to reach out to Jade and Nikki, or to myself or Jazz. And you can send an email to info@bcdha.com and it will get to us one way or another. So thanks very much, ladies. And we very much appreciate you dedicating your time and energy and your evening.
Our pleasure. Thanks so much for having us. And thanks for everybody who took the time to join us tonight. We hope that you've learned something and that it'll be applicable to your clinical practice.
Okay. Good night, everybody.
Thank you, Wendy. Thanks,
Good evening.